I think each family is going to have to make a risk assessment about what the risk and benefit of what we all feel is such an important tradition that we've had since, the beginning of our nation is Thanksgiving. It's an important family holiday. My wife and I are going to have dinner together, a quiet dinner. We're going to get on Zoom and we're going to talk and smile and laugh and drink and eat with our children who are doing it distally and virtually.
Did Dr. Fauci's discussion of Zoom Thanksgiving bum you out tremendously when you saw it just now or before? Because it definitely did to me, because I love Thanksgiving. It's my favorite holiday. For years, we've done it at my parents' house. My mom makes this stuffing with a stale Italian bread and Italian sausage and mozzarella and parsley, and it's amazing. And there's always a bunch of people, but it's a bunch of people indoors in the midst of a pandemic, and that just doesn't work. It doesn't work. We can't do that this year. We're not going to do it this year. If your heart is set on traveling or having people over this year for Thanksgiving, you need to listen to my next guest. Dr. Derek Cass, an emergency room physician here in New York, contracted COVID earlier this year and has since recovered. And Dr. Saira Madad, an infectious disease epidemiologist, member of the Federation of American Scientists COVID Task Force. All right. Let's just start. Open-ended question. I'll start with you, Dr. Cass, first, and then you, Dr. Madad. Thanksgiving plans. How should people be thinking about it?
The same way we thought about the holidays since this pandemic started, which means you need to be with your nuclear family in your house. If you want to do a Zoom and you all eat the same meal at the same time, that's great. There should be no interstate travel. You should not be eating dinner with anyone you don't live with. Unfortunately, the pandemic is raging all over the country. There's nowhere safe, and no test can guarantee that you're not bringing the virus into your house.
Dr. Madad, you're nodding your head.
Yeah, I completely agree. The safest way is to celebrate Thanksgiving within your own household. If you are going to merge your social bubbles, it's really important to understand now is the time to quarantine for 14 days. So if you're going to merge non-household members and you want to do it in a very small, gathering, you want to go ahead and quarantine now, and then you want to add on some, the preventative layers. It's not a, one size fits all type of approach. You want to add on more layers, have it outdoors, keep family units together, don't share utensils. So these are things that we want to continue to do to essentially reduce the risk of contracting and spreading COVID-19. The other thing that I'll just quickly mention is that there's no face of COVID-19. You don't see somebody and say, oh, they may have COVID-19.
Right.
I mean, you want to make sure and you want to assume everybody has it. And so with that, you want to take on these preventative measures that we've all been discussing for months on end.
Well, Dr. Cass, talk more about the testing, right? Because it seems, I know, I've been working through this, trying to come out, how can I escape my own public health commitments so that I can see the people I love on Thanksgiving? Literally an intellectual game I've been playing with myself. So you want to say, what if, it's just a few people and everyone gets tested and then they lay low for a week?
So there's no way around this. I mean, I think that everyone I know has asked me about special rules, getting tested, waiting for a period of time, testing people at the door. And we saw this at the Rose Garden. I mean,
Right.
Let's be honest. We've seen super spreader events that have had testing, quote unquote, and there are no guarantees. Look, people are going to do things and they're going to take risks. And so we're trying to give people advice to mitigate those risks. But if you're trying to do the right thing, unfortunately, Chris, you can't get around the rules.
Well, okay, but it isn't binary, right? So I think the safest thing to do is to have it with your nuclear family and Zoom into other people. That's
okay.
Clear. Not everyone's going to do that. So on a risk spectrum, I mean, one thought I had was it's going to be cold in much of the country, Dr. Madad. But if you need to see people and maybe you have a drink or a celebratory something outdoors. Outdoors is so much better than indoors. The idea of people in a house in winter together, that's the nightmare scenario for spreading. Am I right?
That's absolutely right. We talk about, risk of transmission increases if you're in confined spaces, crowded, areas, and, you have, poor ventilation. So that's, kind of a super spreading setting right then and there. So you want to avoid these 3 C's. So as much as you can have this outdoors. The other thing is voice etiquette, right? So we know in the holidays, people like to sing and chant. These are activities that expel more, droplets and aerosols. So you want to not do those things. You want to keep the family units together and then space them out. So these are just some tips, but, certainly we want to make sure that people are doing it, safely as much as possible.